Cost is another major question that people have. Obviously everybody wants to save money. We want to spend the least amount. Like I said earlier, the most important thing when it comes to cost is you have to realize you want to invest in something that's going to last long term. If you go somewhere where they do this a few times a year, they don't know all the pitfalls. They may do it in a way that you're going to have to repay for someone like me to redo the work, or you're going to have a device that's not going to last as long because it's not cleansable. The implants aren't put in the right positions. So don't just go off of price. Don't go for the lowest price. You want to find someone who's an expert in this, that this is what they do on a daily basis. Look at their results, look at their reviews, and make sure that you're investing in the right person. In foreign countries are a little scary just because who are you going to complain to if it goes wrong? For me, implant placement in the wrong place is not the worst thing. It would be getting a disease or something because they didn't clean their instruments properly. That would be my bigger fear, because there's not as much regulation or follow-up on that. So the ranges for the all-on-4, the teeth that permanently stay in our office, can range in the $18,000–$19,000 range up to the $25,000 to $30,000 range if someone needs the zygomatic implants, the advanced surgery on the top. The bottom is a little bit more straightforward because usually people have more bone in the bottom, and so we don't do zygomatic implants in the bottom. Bottom can range from the $18,000 to $19,000 range up to the $25,000 range, like I said, depending on financing. A couple other factors. We offer a couple discounts. Basically, we're working to try to make this a lower cost option. Unlike the foreign countries where, there's no regulations on how sterilization processes are happening, that kind of stuff, we have a lot of regulations to protect you as the consumer. We have to send in a sterilization report every month, or every week actually. There's a lot of things that we have to do to make sure that our processes are done right and that you are protected as a consumer. We are constantly working at lowering the cost because we want to be able to help more people.